This is a presentation on hepatitis B created by me, Tekki. So the overall information first. Hepatitis B is a dangerous liver disease which is caused by the hepatitis B virus. There are two types of hepatitis B. One is acute, meaning short-term, and another one is chronic, meaning long-term. There are no cure for this disease, but there are vaccines that could help prevent the disease. So adults would normally recover within 6 months, but if not, they would develop the chronic hepatitis B. And chronic hepatitis B could lead to other harmful fatal disease like liver cancer, cirrhosis, or liver failure and fibrosis. Okay, for the causes of the disease is caused by hepatitis B virus, which is a microbe that causes hepatitis B, hence the name of the disease. The virus will need to attach itself to a cell that would help them to duplicate, reproduce itself to affect the body. And the hepatocyte cell, which is in the liver, is the most fitting for this reproduction. So at first, the virus would enter the hepatocyte cell and makes its way into the nucleus. And inside the nucleus, it would put its DNA into the nucleus. And the DNA would be transcribed by the RNA, creating a strand of RNA. And that RNA would leave the nucleus into the cytoplasm, which would be translated into a strand of the virus itself inside the cell, and then a part of it would return itself into they would create like a sealing thing, like a package, and it would leave the hepatocyte cell to another hepatocyte cell, which will continue its the process. So first it enters the cell into the nucleus. The DNA gets transcribed, becomes an RNA, leaves the nucleus into the cytoplasm, which could go two ways: is inside the cell, which would make the disease happen, and another one is to go inside this kind of package that will leave the cell and then to affect other hepatocyte cell. Okay, for the history and the current research of this disease, the history first. Hepatitis B is discovered by Dr. Barack Bloomberg while he was conducting a study on the inherent differences in 1965. It has been 55 years now since we discovered the disease, and the research of this disease has been constantly improving throughout the time, from the discovery of the vaccines, and now many things are being developed to help the patient of this disease. Like nowadays, the cure is still there are people who are still trying to find a cure. The cure is still being developed. New types of vaccines are being developed. So the first type of vaccine is the heat-treated one, and nowadays, in the present time, the synthesis hepatitis B vaccine is being developed. Hepatitis B is most prevalent in Asia and in sub-Saharan Africa. About 292 million people are infected with chronic hepatitis B. About 1 million people die from this disease, or from this disease developing into other fatal disease. The most frequent age of people who are infected with hepatitis B is between 20 to 30. Most of the people infected are males, and HPV is a congenital and acquired disease, and it is a communicable acquired disease. So the symptoms of hepatitis B include stomach pain, fever, dark urine, pale stool, loss of appetite, weight loss, flu-like symptom, and yellow skin. The infections of hepatitis B, it could be infected through the bodily fluid like blood and semen. Most common ways that HPV could be transmitted is through blood and sexual contacts. But if we could prevent those, another problem is from mother to child, which is there are a lot of numbers of people affected through that way also. Excuse me. Hepatitis B majorly affects the hepatocyte cell inside the liver. Though the percentage of it affecting other cells is really low. The virus attacks the liver cell, which leads to symptoms which makes it more vulnerable to other disease, which could develop itself also to other diseases like cirrhosis, fibrosis, liver failure, and liver cancer. Most adults could fight off this disease, could recover him or her within like 6 months, but if not, about 10% of adults, and 30 to 50% of children, and 90% of babies will develop chronic hepatitis B. So as you can see from the percentage, the younger you are, or the elderly also, is more vulnerable to this disease. As you can see, 90% of babies are, if affected by hepatitis B, will develop chronic hepatitis B. For the response and treatment of this virus of hepatitis B, the immune system is the main part of curing this virus. As I said before, that the virus has no cure, so the immune system is the only hope, I guess, for patients that is affected by this disease. So as I said, that children and the elderly are more prone to developing chronic hepatitis B because their immune system is weaker than adults. So if the virus could be stopped before it develops into a chronic hepatitis B, the symptoms, it would be the best, I guess, that I could say. And moreover, the innate hepatitis B, or I guess innate means like from creation. So from mother to child hepatitis B, or innate hepatitis B, it makes itself so that it's almost undetectable by the immune system. So people who are born with hepatitis B are more likely to develop chronic hepatitis B later on. So for the treatment, right after exposure of this disease, an injection of immunoglobulin or antibody could help prevent, though it's only temporary, so it's only for a little bit. And person who haven't got the vaccine is recommended to get the hepatitis B vaccine because there are no cure for this disease, as I said. For the acute infection, there are not a lot of ways for you to treat this infection, this virus, because the body would likely to cure itself on its own. So proper care of the body seems enough for most cases. But if the virus gets severe, that's when the use of drugs is recommended. And for the chronic hepatitis B, some treatment are still being developed for helping people who are infected with chronic hepatitis B. Like the medications, they are and they are most likely to need to take the medications for the rest of their life to treat this virus. So this is the last project of biology, my last work for biology in grade 10. I would like to take this a little bit of time at the end of the video, a little bit of the session, to thank Miss Phi for all you've done throughout the year for me and for my class, for everyone. I greatly appreciate what you've done for me. I hope that next year the students, the 08 students, would be good kids, and I hope that you won't have as much work to do. I hope that you take care of yourself, and thank you for being my coffee buddy for grade 10. I hope we could spend some time drinking coffee next year too. Thank you, Ms. Smile.